A situational analysis of the condition of children and adolescents in Uzbekistan reveals significant progress in equitable access to healthcare and education, along with major legislative changes in child protection. UNICEF and the Ombudsman for Children's Rights of the Oliy Majlis of Uzbekistan presented the results of this analysis. The report highlights near-universal access to education and healthcare, along with improvements in policies and laws focused on the best interests of children. It also identifies key areas for further improvements in the well-being of children and adolescents.
The analysis emphasizes human rights principles such as equality, non-discrimination, and fairness, focusing on creating equitable opportunities and outcomes for all children.
This year, this United Nations Convention is turning 35 years old. So this is an anniversary, and it is the most ratified convention in the history of the United Nations. So this is the reason that I believe that all the countries understand the importance that at the core of this convention is the humanity, and everybody wants children to thrive, so that the boys and girls really have their well-being and get the chances in their life and can develop their talents.
Uzbekistan has made notable progress in providing universal healthcare with significant improvements in access to primary care and service quality. Implementing a national health insurance program under the Uzbekistan 2030 strategy aims to reduce early mortality and increase life expectancy. However, gaps remain. Around 9,000 children are still unvaccinated, and stigma and limited access to preventive services make it difficult for children and adolescents living with HIV to receive care, with only 31% of them accessing antiretroviral therapy. In education, primary school enrollment reached 99% in the 2021-2022 school year. Preschool enrollment grew from under 30% in 2017 to over 73% in 2024, with nearly 2 million children enrolled in 2022-2023. Internet access is now available in 94% of schools, boosting digital learning and ICT access. However, concerns persist about education quality, particularly in basic skills and competencies, and there is still much to be done for inclusive education. Uzbekistan has also made strides in institutional reforms and legal protection for children. For example, the law on protection for children from all forms of violence was approved by the Senate and is waiting for a president's signature. As part of childcare reforms, 23 orphanages have been closed in the past 2 years, with 2,448 children in family care. Despite its protest, 79% of children in institutional care are also with disabilities, indicating the need for more family support and reintegration services.
You know, as child experts, we always see the glass half full. It's never fully full for children. So all countries have very happy about the law on the elimination of all forms of violence against children, which has been passed by the Senate. And we really look forward to the endorsement and the approval from the President of this law, because it will ensure that it's operationalized in all aspects, at school, in the health centers, everywhere, to ensure that children are treated with fairness, with love, that children are heard.
The analysis was developed with the input of government ministries, non-governmental organizations, and people with disabilities, including adults and children. The findings confirm the significant progress Uzbekistan made over the last 5 years and point to areas that need further improvement. For reference, the last analysis was conducted in 2019-2020.